January evening. My name is James Cognac, and I'm with Bruce Power, and I really appreciate you taking the time to join us this evening. We have a really interesting agenda and discussion ahead of us this evening. We've had a lot of input from the community on key questions and topics that people are interested in. But, despite the fact that we've got I think what will be a very uplifting and optimistic and forward-looking message and discussion this evening about how we beat the COVID-19 pandemic, none of us should minimize just how challenging this has been on our families, on our communities, on our province, on our small businesses, and millions of people all throughout the world, and our neighbors here in the province of Ontario in particular. If there's one word that can really summarize Ontario's response to this pandemic and our community's response, it's resilience. And tonight is all about really our last stand against COVID-19. And that last stand against COVID-19 really consists of three elements. It consists of additional measures in place so we can double down and bend the curve and ensure that we continue to minimize the spread of COVID-19, minimize the cases of COVID-19, save lives, and also protect the precious capacity of our healthcare system. It's also about discussing the path forward on vaccines. Sitting here tonight, we are in a situation where we have people in Grey Bruce, who you'll hear from Dr. Arra a little bit more this evening, who have been vaccinated against COVID-19, which was something that was unheard of 8 to 10 months ago. And thirdly, is really some of the spin-off impacts from both of those areas, impacts on small businesses, impacts on mental health, challenges with our kids who have had to change their school routines, and the list goes on and on and on. So we're really looking forward to discussing those serious issues tonight. But while this is a very serious discussion and it is very challenging times, there is light at the end of the tunnel. And that's really what we want to focus on tonight. And how do we get to the end of that tunnel together? So with me this evening, I have obviously Dr. Arra, the medical officer of health for Grey Bruce. We'll be hearing from him in a few moments. We have the Honourable Lisa Thompson, MPP for Huron-Bruce, and the Honourable Bill Walker, MPP for Bruce Grey, Owen Sound. Before I pass it over to Bruce Power's President and CEO, Mike Renchuk, to kick off this evening, there's a couple of public service announcements I would like to make for those of you that have tuned in this evening. The first is that communications, and Dr. Arra, you told me this when we started some of these back in March, in a pandemic, factual, regular, consistent communication save lives. And that's really what tonight is all about. So for those of you that are on social media, those of you that are watching from home, we're going to be live tweeting out through our Bruce Power social media accounts. And if there's key issues of interest to your friends, to your neighbors, to the people in your social networks, please share that information. Facts are our friend. The second thing is I really want to thank Rogers TV, Bruce Telecom, CFOS, and MyFM, all of our local media, for carrying tonight's event, in addition to those of you that are watching it online. One of the things I have to say is our local media has consistently been such strong supporters, whether it's our newspapers, whether it's radio, whether it's TV, whether it's our online publications. Our local media has been tremendously supportive during the pandemic of getting good factual information. And I really want to give them a shout out, in particular the media who are covering tonight's event. And then finally, for those of you that are on social media or have access to the internet, I'd encourage you to, on your iPhone or your Android, to go to the App Store and download Grey Bruce Huron Strong. There's also a website called greybrucehuronstrong.com. This is a joint initiative between the Ontario Nuclear Innovation Institute and MPX Innovation, who's a key strategic supplier to the nuclear industry based primarily out of Kincardine. And they've just done some amazing things with this app. There's over 8,000 local residents involved. There's community contests. There's fitness challenges, mindfulness activities. There's a program they recently launched called Instagrams, which is my favorite, where you can volunteer to help a senior citizen who may be stuck at home and lonely, of course, with appropriate distancing and everything, but to be able to partner with, so people have somebody to talk to, upcoming events, local fundraisers, and a whole range of other things. And as we get further down the road with talking about vaccinations and things like that. This will continue to be a communication platform. Additionally, we also have a lot of information on here with respect to buy local. This is a tremendously tough time for our small businesses, and every single dollar, to the extent we can spend it, that we can spend it locally, is really important to the vibrancy of our communities. So with that introduction, I'd now like to pass it over to Bruce Power's President and CEO, Mike Renchek. Mike.
Hey, thanks, James. Well, good evening, everybody. I'd like to thank Dr. Arra for joining us tonight and being able to talk directly to all of our communities about COVID and the response that is well underway. You know, we find ourselves in a state of emergency in the province, and we are experiencing the onset of a second wave of the pandemic. And, you know, I think by working together and that clear communications, we'll continue to get through this together and in a good way. I'd like to take the opportunity at this time to continue to thank all of our frontline medical workers. You know, they've been so strong throughout the entire pandemic, and they continue to serve each and every day, even in the face of the virus being around them. And it's through that hard work and perseverance and resilience that we'll continue to help each other to get through this. I'd like to also thank all the frontline workers, particularly those people that are working in grocery stores and other essential services that really help our communities stay strong and stay vibrant. I'd like to thank all of our wonderful teachers for all the work they're doing to ensure that our children get a good education and continue that education even through the pandemic. And I'd like to thank all of our great workers at Bruce Power for all they're doing each and every day, keeping the lights on, providing 30% of Ontario's electricity at 30% less than the average residential cost, and producing medical isotopes that we're using globally to sterilize about 24 billion surgical gloves or medical swabs. And quite frankly, sterilizing 40% of the once-use medical equipment around the world at this point in time is an extremely important task that we have. And they're just doing a fantastic job. They come to work each and every day, and they give it their very best. I'd like to thank all those folks in the community that are going out of their way to support small businesses right now and local charities, things like our local food banks and United Way. I appreciate the engagement and involvement in our Light the Way campaign that's really gone out to help many citizens who are in need throughout our counties. It's these times we find where it's an all hands on deck moment, that when we work together, we pull together, we'll be strong. We'll work our way through this each and every time we face adversity. And in this case, our resilience and our diligence has to continue to be around washing our hands, wearing our masks, keeping our distance. It's these basic things implemented well will carry us a long way into the future, with vaccines now on the horizon. With that, I want to thank everybody for joining us tonight, and I look forward to hearing what Dr. Arra has to say, and Minister Thompson and Minister Walker. Thanks, James.
Great, thanks very much, Mike. And now we're going to play a very short video. This is a video that we relaunched across the province just this week. And, you know, and while we can make a difference in Grey Bruce and here on Perth, we can also make a difference across Ontario. And so I want to share with you a TV ad that we just relaunched today that is airing all across Ontario, that is really meant to underscore really what Mike just talked about in supporting the broader health measures and the state of emergency that the Premier and Ministers Walker and Thompson are going to be talking about in a second. So let's play this video so you can see what our fellow Ontarians are going to be hearing from us over the course of the next month.
These are the faces in the fight against COVID-19.
Our kids.
Our loved ones.
Our neighbors and the elderly.
The frontline health workers.
The custodians.
The truck drivers.
The grocery store workers.
They aren't numbers.
No, they're not numbers. They're people.
All with their own hopes and dreams.
Fears and worries.
Families and friends.
Are we going to be there for them? You're darn right we are.
We'll be there for them when we do what our leaders and public health officials tell us to.
We'll be there for them every time we wash our hands or just stay at home.
This is Ontario's spirit.
These faces remind us of why it matters.
This is the time to band together. To be our best.
To take action.
To just stay at home.
Stay at home.
Stay at home.
Just stay at home.
So I think that video really articulates very clearly what it is we have to do and why we have to do it. So with that, I'd like to welcome the Honorable Lisa Thompson, MPP for Huron-Bruce, and you're also going to hear from her colleague, Minister Walker. But maybe just before I pass it over to Lisa, one of the things that people don't often realize is, over the course of the last 10 months, the government of Ontario has had to make some very significant and severe decisions. In fact, I read a news report just in terms of just how much discussion there has been at the cabinet table during that period of time and the number of decisions that have faced the government. And, what I can tell you, working through in my role as Bruce Power with many people throughout government, is these are decisions that people do not take lightly who are in public service. They're difficult decisions. They know they're decisions that have to balance a range of factors. And they often are decisions that are imperfect with incomplete information, but they have to make them. And they know they're not going to be popular, but, on balance, try to do the right thing and try to do that consistently and check and adjust as they go. And I can tell you, as somebody who in my role at Bruce Power gets to work with these officials, that's something that I see firsthand. It's not an easy job. As elected officials, they know that they're not to be let off the hook. That's part of a democracy. But it should also be that as members of the community, and these are individuals who live in the community with us and are part of our community, whether they be MPPs, MPs, members of municipal council, members of county council, these are all individuals that are trying their best and they're trying to do the right thing. So with that, I'd like to thank and welcome Minister Thompson, and to leave it to her to share some of her thoughts as the MPP for Huron-Bruce, and really reflect on some of the things between her and the Premier and the rest of the government that they really need us focused on. So over to you, Minister Thompson.
Okay, thank you so much, James, and good evening, everyone. It's a pleasure to join you again. And I just want to share with you that it has been 10 months, and I'm sure all of us have experienced it in our own ways. But the one thing that keeps us united, particularly in this region, is the sense that we're all in it together. And I really appreciate the efforts of Dr. Arra and Bruce Power for reminding us of the importance of continuing to be in it together. We heard reference of Great Bruce Huron Strong just moments ago, and we are strong, but it is because we have the likes of Dr. Arra as our medical officer of health, and companies and corporations throughout our region powering us all through this pandemic. And I'm sincerely so proud and in awe of the commitment that we see from our medical professionals through to our small businesses and every one of our communities. I'd like to echo as well the sentiment that we heard earlier from Mr. Renchek. Mike is always eloquent and speaks from his heart. And I stand with him when we discuss the importance of recognizing the effort that has gone in from the front line. And that front line is very, very wide in my mind. It's not only our nurses and PSWs and our EMS and our doctors and our caregivers, it's our teachers as well. And it's our parents that are at home now helping students with their online lessons. Everybody is just a touch tired. I respect that immensely, but together, we're all in it together, and we will get through this by supporting each other. And that's why programs like Light the Way, Lead by Example are so important. So I hope everybody has downloaded the app that James had spoke about before, because it is something that makes our region unique. And, when you think about the news that we heard today and reflect on the caseloads and the numbers of active cases versus those recuperating, there is hope. Light is shining at the end of the tunnel. but we have to remain diligent. We can't let that little bit of light that's shining right now diminish the need for all of us collectively to stand strong, respect the protocols that are asked of all of us, and ensure that we continue to support our local businesses. And, you know, I say that sincerely as well, because I appreciate so much how our local businesses through the last 10 months and maybe for weeks and months to come have struggled, sacrificed, and adapted to the new environment. They are doing everything they can, from the protocols that are expected to them through to adapting to online and curbside sales. And I tip my hat to them for that. And I'm very pleased to share with everyone tonight that our provincial government is also in a position whereby we can support our small and medium businesses throughout all of Ontario with a brand new program that was launched just last Friday. It's Small Business Grants. It's a program that is open to everyone to apply for. And depending on your verification and criteria that you meet in terms of being eligible, you have upwards of $10,000 to $20,000 that you can access in a grant format. And that's over and above the energy and tax rebates that are already available, as well as the PPE grant. And so I encourage our businesses throughout this region to look into the Small Business Grant Program, because it's there for you to help and give you hope as well, that there is opportunity to bring together a whole measured approach to your supports. And just recently, colleagues of mine, we teamed together and we've introduced a website, reliefwithinreach.ca / in our particular instance, / Huron Bruce. And this is a one site that brings together all provincial and federal programs small businesses can tap into. And I encourage you all to do just that. Again, visit reliefwithinreach.ca / Huron Bruce to see firsthand what's available to you from both the provincial government and our federal government as well. Because again, we're in this together, and we have to be proud of the fact that in this particular region, we have reason to have hope. But we need to be mindful that we need to stay the course, respect the protocols asked of us, because our neighbors may not be so lucky. Our neighbors may be having communities whereby there's work transmission of COVID in the workplace, or there may be neighboring communities that may not be seeing their schools open as soon as other communities. So we have a responsibility to make sure that we help them get back to school, to help workplaces squelch transmission, and most of all, keep this region strong. So I thank you for tuning in, and it's important to embrace the hope and that light at the end of the tunnel, but we cannot stop being diligent. Thank you for joining us this evening.
Great. Thank you very much for that, Lisa. I think it's a great message. And really what I want to do now, I think this is a perfect segue, Lisa. I think you set it up well. Before I introduce Minister Walker, I want to play a very short video that has been released by the Ontario Vaccine Task Force and retired General Rick Hillier. So let's play that video now. I think it really will explain, more broadly, what is that light at the end of the tunnel, which we're going to have a broad discussion on with Dr. Arra here in a few minutes.
The first COVID-19 vaccines have arrived in Ontario. This is great news. These vaccines are Health Canada approved, and they are safe. Our vaccine supply will not arrive all at once, so those in vulnerable circumstances and the healthcare workers of our great province will be the first to get vaccinated. Until those vaccines are widely available, it's critical that we all continue to follow public health guidelines. Practice physical distancing, wear a face mask, wash your hands frequently. I encourage everyone to be patient. This is the biggest vaccination program in a century, and we expect that it will have its challenges. We are working closely with Health Canada to plan for the next deliveries of the vaccine. And we are committed to being as open as possible so the people of Ontario can follow along on the journey and know what to expect at each step. This has been a very difficult period for all of us, but there is a light at the end of the tunnel. Please stay the course with us. Together we will beat COVID-19.
I think that really sets the tone and summarizes and focuses tonight's discussion, because that's what it's all about. We're not just doing one thing, we're doing two things. We're working on the one hand to minimize spread, to bend the curve, and also in parallel rolling out vaccines. I think that's a great segue, and I'd now like to welcome Minister Walker, who's the MPP also for Bruce Grey Owen Sound. I want to thank Minister Walker for joining us tonight, and love to pass the floor to you, Bill.
Thank you very much, James. Always a challenge to follow a great guy, a great leader, and a great speaker like General Hillier, but we're just so fortunate to have him leading such an important task. I'm going to keep my remarks relatively short and sweet. I just want to say, first and foremost, thank you to every single person out there who's doing exactly what the General asked, obeying by the guidelines, making sure you keep your distance, wear your mask, washing your hands, and frankly, just respecting and coming together for the betterment of everyone. I can't say enough how impressed I am with the people of Bruce Grey Owen Sound and neighboring Huron-Perth. To you, James, to Mike, to the whole, all things that you have across the board, not just related to all the great things you've done socially and the leadership you've shown, and continuing to drive your business. I always want to make sure we talk about the positives of the energy and what you're doing to allow us to have affordable, reliable energy rates. And I'm a big, big fan, as you're well aware, James, of the isotopes and that difference you're making even in something like COVID. All of that sterilization is a partly responsibility of you with isotopes and Bruce Power. So thank you so much. To Dr. Arra, to you and your team, again, it goes without saying how incredibly well you have managed, how you have led in a very caring but efficient manner, ensuring that we all have the ability. So to everyone, the vaccines are on the way. We're seeing positives along the way in all of our different capacities. I thank everyone. I know there's challenge, particularly in our business community. We don't take those decisions lightly, but for the greater good, we had to make decisions. We will make decisions. We'll support you to get through this. We will come out of it. Hold on to the hope, ladies and gentlemen. We are here. We will come through this together. As Lisa and James have said, Grey Bruce, Huron Strong, that's what it's all about. That's the spirit of community. Thank you to everyone. Keep doing your part, and we will get this behind us. And just one little plug for Wyerton Willie. We'll see whether he predicts a longer or a shorter COVID season. Thanks so much, and all the best.
Great. Thank you very much, Minister Walker. And, and really appreciate your comments to essential service workers out there, whether they're paramedics, whether they're healthcare workers, whether they're in long-term care, grocery store workers, truck drivers. And, frankly, also, we do get, and I know Mike mentioned this in his remarks, we do get a lot of recognition often as an organization who is generating electricity and isotopes. And while we have a large portion of our employees working from home, because that is the safest thing to do to minimize the number of people, we still have a considerable number of individuals who have to be at our facility, like other facilities that are operating right now, other hospitals and other places. And so to those workers in particular, if you have a loved one who is out at work in any of those essential workplaces, they're really the frontline heroes in the fight against COVID-19, because our province does not run without them. So thank you very much for that, Minister. And with that, I'd now like to move over to Dr. Arra. I don't think Dr. Arra needs much introduction. He has become a household name here in Grey Bruce. I occasionally will be in a discussion and Dr. Arra's name is just mentioned so frequently because he's makes himself available to do smaller virtual sessions with people, to makes himself available to the media, and has really become an individual that we've been able to count on here in our community for very reliable, factual, and I would always say thoughtful and steady advice. One of my observations with Dr. Arra is when things are going great, he doesn't overreact to that, and when things are a challenge, he doesn't overreact to that either. And I think that kind of steady, calm, factual, step-by-step leadership is exactly what you need in a pandemic or any crisis. So, Dr. Arra, thank you very much for joining us this evening. And I'd now like to pass it over to you. I know you have some remarks that you want to share with us and a bit of an update before we move into questions.
Thank you, James. Thank you, Mike and Bruce Power, for this channel of saving lives. Thank you, Mr. Thompson and Mr. Walker. I really appreciate your time, and I know how busy you are, and echoing the public health advice and being out there to hand the public and the community the information they need to make the decision that will save their lives, their families' lives, and the community is greatly appreciated. I cannot thank people around the table enough. This has been, the most difficult time for communities, for the province, for the world. It's a pandemic that happens once every 100 years, and staying the course for all of us for 10 months, and it seems like 10 years, more or less, is not easy. I realize it's not easy. However, everybody has been doing their best, and the heavy lifting is in the hands of the public and the communities in Grey Bruce, Huron, and Perth. Everybody was doing their best and have been doing their best, and for that I thank everybody. It's worth starting with the provincial stay-at-home order and lockdown. And I've been thinking about two aspects of it. One of it is the benefit for the province and Grey Bruce, and the second one is the individual level, what each one of us can do, our audience, our listeners. And I flipped back and forth whether I should start with the first one or the second one, and I do believe the benefit is what we need to start with and remind ourselves how important this is to all of us. And I will go through the situation report here and in Grey Bruce and the numbers. However, the benefit is, I can see it in December. The bulk of my team's work was how can we prevent transmission, specifically if our neighbors in the province, wherever they are, might have a higher risk of transmission than Grey Bruce. And if these areas are in the red or in a lockdown and our area is in less risk, we are not an island. Nevertheless, all that planning and work and communication was not necessary anymore when the province issued the lockdown. It has definitely balanced that equation that would be increasing the risk in our area. So people ask the question, is it necessary? We're doing really well. Yes, we're doing really well, but it is very necessary. And that's for Grey Bruce. I would use the adjective necessary. For the province, I can use every other adjective similar to important: indispensable, vital, saves life, vital, crucial. It's in the middle. It's exactly what we need. Indispensable, again, I mentioned it. It is indispensable. So with this in mind, how important this is for us, how can we act on it? How can we action it? Each one of us, the person who's listening right now or who's going to pass it to their neighbor so they can do this, to stay at home. The Premier said it best, you can look at the regulations and all the complexity of it, but it is just stay home. Unless you really have to go out to get food or go to the pharmacy or do something that you cannot stay home while doing. And when you do this, just remember it's painful, but it is saving lives. It's not going to be, you could be young, you're not going to be affected. However, the person who's going to get the virus is going to pass it to somebody else who might not be fortunate enough to have that good health. So with that, you look at the situation in Grey Bruce, and it remains relatively favorable. We've went through 2 weeks of surge that was expected after the holidays. Actually, I'm very proud of the community. I'm proud to be part of this community, that the surge was not larger than what it was over the past few weeks. We've seen the numbers going up to a level where they were close to early December, not as much. However, they went up, and now they've been tapering down, and I've said it in different settings, which is a bit difficult to make a bold statement and say the numbers will go down. But I'm not a gambling person, but what I based my prediction on is the commitment that the community in Grey Bruce have shown over the past 10 months. It's something I can bet on. And it's not a bet based on just guess. It is solid as your efforts in the past 10 months. And I know that the numbers would go down and they will go back to a baseline that is quite manageable, like what we're seeing right now. The past week there's been an average around 3 or 4 per day, which is a success to everybody who's listening to this message and everybody in Grey Bruce who stayed the course. And you look at the case count and you compare it to the past few months or weeks. Early December was probably the peak for our area, and the numbers start going down. And we mentioned to the public, everybody echoed the message. Bruce Power put out a lot of communication. I know firsthand that the amount of investment financially and time and effort, along with everybody around the table, to say when people get together over the holidays, it is inevitable the numbers will go up, and they went up. So we know the recipe. We know exactly what's going to happen, and we know the remedy for it. And when you look at the projection locally, it is favorable. The province, relatively to other jurisdictions, to our neighbors in the south, we're still in good condition. However, we really need to be cognizant that numbers don't just go up and down and we forget about them. The past 2 weeks, we had an average of 3,000 or around that. This will translate in later lagging indicators, a technical term for it, which means after 4 to 6 weeks, we're going to see some of these cases that were diagnosed last week going into the hospital, admitted to the ICU, and that's where the capacity of the hospital system will be affected. And people might say, well, in Grey Bruce, we have only 2 cases in the hospital. Well, again, we're not on an island, and our system is built to support universality. That's a technical term for it in the principles of the medical system or the healthcare system in Canada. Universality means you can go get your care anywhere in Canada and nobody will say no. And our hospitals work together, and we're going to see transfer from other hospitals from other regions to our hospitals, and that started already. So you put it all together, we've seen cases of 3,000 per day. They're going to translate in higher admission to the hospital, to the ICU, and unfortunately death. So that's another layer where the lockdown and stay home is crucial, is very important. And we hope that the numbers will go down. I trust they will go down if the public in the province abides. And again, I have faith in our community. I have faith in our country. We are privileged to be, handling and managing a pandemic in Canada, not in other countries. Return to school is another subject that will be coming next on the horizon. We are in Grey Bruce in really good standing to proceed what we started in the first term of school. We know that there were cases in schools. The screening, handled most of these cases, prevent them from going into school. Nevertheless, when nothing is perfect in these measures, and the more of them, the more we implement of them, the more committed to them, the better the results. We've seen that there were cases in schools in Grey Bruce, but there was no transmission there. So the first term universally had one outbreak that after the fact, after the announcement, you look at it, and the transmission could have probably happened outside of the school only with 2 cases, usually 3 cases to justify it. Nevertheless, we are ready to go back. Does this mean that it's carte blanche, that it's a safe place? It's a pandemic. We need to remember this. And the fact that the kids are going back to school, that does not mean that the stay-home order does not stand. And I get this question quite often, when the schools are going to be opened in some time, is the stay-at-home order will stay? Yes, it would. Going outside of our homes for whatever it is, the activity is different from our children getting the social and educational experience they need. And it is important when the school opens that kids will go back home and not go to a party, not go to socialize. I get this question, and because it's important, there is something there for people not to see. It's not intuitive because the kids are in one cohort in school. That means they can play together after or party, and that's not the case. The risk is cumulative. If the risk to go to school is calculated risk that we accept, going back together after school time adds more risk, and that risk is not calculated, and it's not acceptable to be combined. Not acceptable because it's going to put our kids and our communities at risk. And it's important to remember that the school environment is controlled. The school staff, teachers, workers are doing amazing job to keep it controlled. If kids get together after school, that's not a controlled environment. And if it's a party, birthday party, or whatever it is, that's definitely the opposite of controlled environment. So again, we will be there at some point to reopen school. And I would ask everybody to remember this is not mutually exclusive to staying at home. We need to do one and the other to actually make both work. So that is the heavy lifting that we all need to do. And we know that there is a vaccine coming, coming around the corner. We already had some here, and I have no doubt we will get more and more. And at some point, very near in the future, this whole thing will be not there. There is something positive about pandemics. People think there isn't, but there is one, and it's actually the common denominator to all pandemics. They all end. And in Ontario, we're going to end it sooner because we have vaccine, because we have the technology as a human race, and we made it possible for all of us if we invest that bit more effort to actually end it earlier. And again, I just want to remind people, 2 months ago, there was no vaccine. To many people, there was no end to this. Now it is around the corner. We just need to stay the course, and we need to remember the recipe that really worked for the past 10 months in Grey Bruce, the 3 W's: washing hands frequently, wearing a mask correctly, and watching our distance. We know it worked. We know around the holiday, some of us really had to get together with family, and that, raised the numbers. And we need all of us to stay this course until the vaccine is in enough arms to make this pandemic not existent anymore. And I want to finish with one point. It's really crucial. You hear the term be kind, be calm, be kind. And you put it under the microscope as a term. Where does it come from? It's a hardship. The pandemic is a hardship, and people are in pain, whether it's small business not able to operate, or a person who's not able to go out, or a parent who cannot see their kid, or a child that they cannot give their older grandparent a hug. It's not easy. And in the middle of the hardship, it's very easy for anybody to point the finger and say it's the others that's causing this. It is, in our area, for the past 2 weeks, I've heard it. The past 2 months, I've heard it, but 2 weeks, it's the Low German speaking community, Amish and Mennonite, or it's a visitor, or it's the decision maker, or the professional who are providing the information and the recommendation to the decision maker. None of them. It is the pandemic. That's what's causing the hardship. And that's why we need to be kind. We need to be calm and remind everybody around us, this is not going to end tomorrow. It's going to end in a few weeks, in a few months. And we need to stay that course.
Great. Well, thanks, Dr. I think that's a fantastic perspective. I think you've covered a number of key items, and really now moving into the Q&A, we have had a number of members of the public submit us questions on social media and also directly. And maybe while we're on the topic of vaccines, why don't we jump off from that point? Can you maybe just share with people, with the initial dose of vaccines that have arrived? Can you just give people a bit of a sense on what has been done currently with vaccination, and sort of more broadly, what are some of the preparations that you are undertaking for when that vaccine supply comes available, to make it available sequentially to the groups that need it, and eventually to the general public?
Certainly, that's a key question that's going to change the course of this pandemic. Locally, so far, we have vaccinated residents, staff, and caregivers in 2 long-term care, and the priority set by the ministry, rightly so, is to vaccinate long-term care sector first. That's where we see the stats showing death, unfortunately, and we know that as soon as we vaccinate that sector, the rate of death will plummet like a stone. And that's where we started. And despite the fact that we are in a lower risk area, so the criterion to distribute the vaccine will go to support high risk areas first. Despite that fact, we still received a modest shipment of vaccine was utilized on the same day. The plan going forward is to receive more shipments when they're available. We know that there are many conditions need to be met, and some of them are not in the control of anybody in Grey Bruce or the province or the country. The supply of vaccine nationally has been affected, and that might alter the plans. Nevertheless, the plans will proceed when we have the vaccine. And for Grey Bruce, we started planning in August, and the ministry had directed different organizations to start this plan. And we have 2 types of plan in general. And I say 2 types in general just because the plans might change depending on the type of vaccines coming and the timing of it and the amount of it. And we need to be prepared for any eventuality. And that's a way it's best to plan for emergencies based on assumptions, because there are gaps in information, and that's the way the emergency is, and we need to plan for every eventuality. The 2 major types of plan, the first one is the traditional distribution system of vaccine, usually from the health unit to primary care, family health teams, long-term care hospitals, and usually pharmacies receive it from the ministry directly, but in a pandemic, we will direct it to and share it to everybody. This will be the vaccine that's usually stable. Moderna and other types that will be on the horizon, or they are on the horizon, will be with us very soon. And the second one is the Pfizer vaccine. And this one has a bit less flexibility with mobility. Nevertheless, it's manageable to distribute it through mass immunization clinics. And that's the second plan. And this one, actually, the mass immunization clinic or hubs could utilize both types of vaccine depending on the amount. If we get plenty of it, we can activate different hubs. So these hubs in Grey Bruce can be located in different location. The most optimal have been to the best of our assessment, is the recovery centers that were put up for as a field hospital. One of them in Kincardine, Davidson Center, Hanover, PNH, and in Owen Sound. The Owen Sound arena is used for field hospital high level, and our colleagues in the hospital system, rightly so, have it ready for in case there is surge. And that arena will not be used for immunization. However, part of the facility, other parts could be utilized. Local political commitment to health, it's just to many people, it's a term. To me, it has been crystallizing in many ways to save lives, whether it's the municipal or the provincial or the combination of their work together to make it happen. So those hubs will be ready when we have, will be activated when we have plenty of vaccine. At this point, they are ready, and we have a task force that met earlier today for the first time, and I can see that everybody's ready to hit the ground running to make this happen. And James, I'm sure there are other questions that will touch base on the vaccine, so let's go to the next one.
No, the good thing is you covered a lot of items, I think, very effectively in that answer. And so one more question on vaccines, and that is, obviously you've administered vaccines to some residents in Grey Bruce. Just out of curiosity, what are the top questions, concerns, feedback that you've either heard from the people who have been vaccinated or are likely to be vaccinated soon? What are sort of the top 1 or 2 or 3 things that they tend to ask in terms of both the safety and the efficacy of the vaccine that they're going to receive?
So in general, in Grey Bruce, we have high rate of acceptance of vaccine. Historically, we have above average, provincial average number of vaccines. If you take the school students, that's a proxy to the acceptability of the vaccine, and it's above average. In December, we ran a survey related to healthcare workers and their readiness for the vaccine, and the average for that survey was 70%, which is way higher than the provincial average. And it's a new vaccine. People might be not reluctant to get it, rather, they would have opinions about, I need to see the safety, I need to get this information. And in general, the question that I hear, you might laugh at it, when can I get it? There is quite the readiness for it. And it's a safe vaccine. In our country, every vaccine that's approved through NACI, National Advisory Committee for Immunization. And the threshold to accept vaccine or approve them is very high. For medication, we can accept it with side effects because it's treating a disease or pain or suffering. So if there are side effects to it or adverse effect, that's quite acceptable. For the vaccine, the threshold is so high that there shouldn't be anything, other than the common response from the body to build immunity, which is redness or sore arm, sometimes some fever, but severe reaction is usually not there. In the UK, I believe the first few weeks there were 2 allergic reactions that are severe enough in the whole country, which is quite safe for a vaccine. Again, back to the question, most of the question would be, when can I get it? Or, if there is a comment, thank you for the team and for Grey Bruce to Health Unit to make it available as soon as we can.
Well, I think that's really good context with looking at all of the sort of the various vaccine topics. I think you touched on them really well, Dr. So thank you for that. I really do now want to shift to the issue of schools, and you covered quite a bit about schools in your presentation. And what I'm really taking away from your presentation, Dr. Arra, is if I listen to your comments very carefully, it sounds to me like there is an expectation that kids will be back in school, likely in some regions of Ontario. I know there was some media speculation today. I haven't seen anything come out officially on this, but likely kids in some regions will be going back to school before the lockdown is up. And it sounds to me like you have a concern, or you are reinforcing a point around concern that creates complacency with what folks have to do in terms of staying at home. Am I reading that right, Dr. Arra? Because it is a fair question. I can see somebody asking, why is it safe to send my kid to school, but it's not safe for me to go out? I know you covered that, but maybe we can underscore that just one more time, because I can see how people may ask that question. We had 2 or 3 of those questions feeling it's a contradiction. And maybe you can just kind of underscore, what is the key message you really want to leave with people on why we got to separate out those 2 issues in terms of people's thinking?
Certainly, and this is exactly the point I was making. You rightly summarized it nicely. I can look at it and address it in 2 ways. Probably the practical way, the data way. In October and November, we've seen surge in cases as the second wave started and went up really sharp. And in schools, we did not see outbreaks. That says that if it's circulating in a community, does not mean it's going to be circulating in schools, a controlled environment. And you can infer from it also, if the physical distancing, hand washing, and other measures are implemented, it will be a safe environment, no matter where that environment is. So you fast forward, and now we have a lockdown, and our data show that we are ready to reopen school again. So if that happens, like you rightly said, that does not mean that one is contradicting with the other. One is a sacrifice to make the other possible. If we continue to have the stay-at-home order for everybody except for the essential, and we consider going to school essential, this is in complete harmony. It's not the the opposite, and there's no contradiction between the two. And again, I trust, and I have full trust in the response that's going to take place in Grey Bruce from everybody, whether it's the parent sending their kid and being very careful to school, or the parent who's staying at home when their kid at school, and there's no difference in both activities.
No, I think that's helpful, and obviously with what we expect to be materializing in the coming days, I think that's really an important point for us all to anchor on. And for those of you that are parents and are listening in, and may have other parents who on your social media networks will be live tweeting out, and we have some of Dr. Arra's comments on that. I encourage you to share those with other parents who will be asking that same question. So, Dr. Arra, one of the questions that came in, and in all of our town halls, this question has not come up, but it's a great simple question and something you deal with every day. Can you explain when somebody goes to a testing center and receives a COVID, does a COVID swab, it goes off for analysis and comes back positive? Can you explain what it is you do from a contact tracing perspective? Obviously, you have a lot of these coming in. Give somebody just a bit of an inside look as to what happens in your world when a positive test comes in. What does that do in terms of how you work with the person, either their workplace, the contact tracing? Can you take us through that sort of behind the scenes, how that works?
Yeah, certainly. So in training of public health specialist, which is a 5 years training, that will be a course of 6 months or 2 years, depending on the subspecialty. We will do it in 2-3 minutes if we can. Obviously, we will not be able to, but we would receive the result, and the Health Promotion Protection Act, which is the framework we work around or we work under or within to ensure management of pandemic, would ensure every lab and every healthcare provider would notify the medical officer of health office of a positive test. And with that information will come the contact information of the case. Our investigators, case managers will connect with the person and immediately provide them with a set of, usually it's seamless when you see them in action, but if you know the details that are going to go through, first to support that person with that diagnosis. That's not an easy diagnosis. Then walk them through what they need to do to ensure their health and the protection of preventing transmission to people around them. Walk them through a list of actions and list of reminders where they have been in the past few days, up to 14 days sometimes, to find out where the disease might have been acquired. Look at the risk situation that they could be in, or this risk facilities, or the high risk organizations that they could be in, long-term care, schools. If there is any one of these things, a red flag will go up and it will activate the second team, the school team or the long-term care team, and they would do more follow-up with everybody there. However, the first case also, we would look back in time to see where the acquisition happened, and forward in time to see who else around them might have been in contact with them in the past 2 days or within the period of time of spreading the virus. Then we will connect with all these people back in time and forward in time and cross-examine that information. At the same time, when you're supporting everybody and looking into that information, clinically, we're looking at cross-examining the data to see, is it complete or not? Are people providing the information or not? And is there a reliability issue? Somebody might have memory issue. Somebody might have an attitude issue. And we would engage different partners, whether it's healthcare providers or enforcement agencies, or you name it, to ensure that we would know if there is a chance of transmission, that chance is addressed and the public will be notified. If it's related to a workplace, again, I've said it many times, but to our employers and businesses, please be reassured. In Grey Bruce, we've been following everybody within 24 hours, and usually within minutes if it's a high-risk situation. And we will manage outbreaks in employer space, in workplace, remotely. And if there is need to engage the employer, we would. And we always do if there is risk for somebody else there. So that's in summary something that I would put usually in 6 months to my trainees.
Great. Well, I won't ask for one of those certificates on the back of the wall. I have to do a lot more research than that. But I think that's really helpful because a lot of folks just kind of want to understand what kind of happens. So I'm going to ask you a bit of a subjective question. I know it's tough for you to sort of say exactly, but now we are. Let me think here. We're just over coming up on I believe a week in terms of lockdown orders. It's tough to keep track of time anymore these days, but it's a very new thing, the lockdown orders, and very clearly, I think the government was very clear and crisp on the importance of this. When you, just based on what you're seeing in the early days of the stay-at-home order, where are the areas that you think we need to sharpen up on? Where are the areas that you think that, obviously there's a lot of areas people are complying. I mean, you can visually see mask use and there's a lot of areas people are really following the rules, but where are the 1 or 2 or 3 areas, Doctor, that you look at and say, you know what, we still got a bit of a ways to go there, even just from your own observations or some of the feedback you hear?
Yeah, you see, James, that's a really tough question because most of the community is doing the right thing, and it's usually go the course and combat that fatigue is not easy. If we can remind ourselves that what we're doing and what we are investing in, the sacrifice we're putting forward is saving lives, it really allows us to actually not just find it a bit easier, rather enjoy it. Like when we stay home and it's on the expense of going out and seeing friends, and we